Hi, welcome. I have been into healthcare for more than quarter of a century and I've worked across the world. I've worked with multilateral bodies, I've worked with private sector, I have worked with public sector. I have also served as advisor to the Health Minister of the Government of India. I have written extensively on healthcare, I have delivered talks across the world. I have a few books. What I observed was that healthcare is one sector that touches everyone's life right from the birth. But the irony is, healthcare is supply driven. You will never get what you need. You will always get what the industry has. So that is what we aim to change. We aim to change the governance, financing and delivery of healthcare through a new paradigm of thought leadership. I look forward to institutionalizing the thought leadership and the leadership development for healthcare. And so I created a think tank, Health Parliament. So why a new think tank? There are already dozens of think tanks in every country. Yes, they are. But if you really dig into them, their work, their objectives, and the way they operate, they are actually lobby houses masquerading at think tanks. We wish to be different. We will not make any recommendation unless it's backed by primary research. Whether it's policy ideation, debates, gap analysis, or solutions to the challenges policymakers and industry face, we will do our primary research and then make recommendations. That's how we aim to be the world's foremost think tank. In healthcare, we will create leaders of tomorrow right from grassroots level to industry experts through Health Parliament. Within the Health Parliament, we are also setting the centers of excellence. Amazing work has been done in healthcare, but in islands of excellence. We wish to convert these islands of excellence into centers of excellence to disseminate innovations. The second initiative I set up is the Digital Health Academy. Eventually, this academy will transform to a full-fledged university. We aim to boost the adoption of digital technologies by providing skills development and courses to clinicians and healthcare administrators. And eventually, we will also offer Masters in Public Health in real-life settings, not the theoretical one. We wish to change the way people look at healthcare in terms of education and also in terms of delivery. The third initiative is the International Patients Union. You'll be surprised that healthcare revolves around the patient. All that we do is for patients. But do we really take care of them? They're nowhere in the picture. Patient's opinion is never sought. He is just an objective to be sold a product or a solution. We wish to change that. I am organizing patients across the world, getting onto the one platform to be a voice before the industry and the governments. Just not being a voice, we want to go beyond. We want to offer online consultation to patients. We want to set up health libraries, give them authentic information. And more than that, we want them also to look at leading a group or communities locally where they interact with themselves to handle their concerns, their conditions. We also will look at setting up registries for clinical trials where they can enroll at the touch of a button. We have a whole lot of things in the offering for the patients. Within the Health Parliament and Patients Union, we are also setting the Guidelines Development Group. We realize for most of the issues related to health, they are in guidelines. So we are coming with guidelines and you will keep seeing them being released at Health Parliament and at the International Patients Union. So in all, we are out there to transform healthcare. Come, join the movement. Let's change healthcare. Thank you.